Okay, hello everyone. My name is Q, and I'm honored to be here. And thank you so much for your kind invitation for today's amazing event. And hopefully, you learned a lot and you experienced a lot from this event. So, unfortunately, I cannot see you, but I'm sure you will be able to see me and hear me well. So, what I'm doing so I use some brain imaging techniques to understand how and why music therapy can improve movement, cognition, and our socio-emotional processing. So I recognize that the participants or caregivers or patients may not be as concerned with some statistical findings like statistical significance like a p-value below than or five or so, but rather with how research findings can be applied in your daily life. So I feel fortunate to be here at Johns Hopkins, where my dual role allows me to bridge these both clinical and research finding needs. So in today's presentation, I would like to explore how music moves us and enhances memory and bring us together for the atypical Parkinsonism. And I've planned a brief demonstration to show this in action. So before we dive into today's topic, I'd like to briefly introduce our Center for Johns Hopkins Center for Music and Medicine. And our center is a collaborative and multidisciplinary initiative where physicians, neurologists, nurses, music therapists, including me, and physical, occupational, and speech therapists. So we all work basically together, led by the Dr. Alexander Pantelya, who is the associate professor in the neurology and neurosurgery and division of movement disorders at Johns Hopkins. So we combined our expertise in research and clinical care to explore how music can benefit patients, healthcare workers, and musicians. Especially like we are developing the music and rhythm based therapies, and like my role is research on music and the brain to understand the how music can helpful and impact to our caregivers and the patients their daily life. So what is music therapy? So I'm not sure how many people you've heard about music therapy or you've experienced with music therapists before, but music therapists are licensed in Maryland and also are credentialed professionals recognized by designation MTBC, like a music therapist board certified. So to become a MTBC, these professional we need to hold at least a bachelor degree in music therapy and complete over 1,200 hours of supervised field work, and also we need to pass a rigorous national certification exam to be a MTBC music therapist. Additionally, many music therapists pursue advanced degrees, including master's and doctoral degrees, bringing even deeper expertise to their clinical practice. So, in my case, I've been working as a music therapist, but I aspire to understand how the brain functions during as well as before and after music therapy sessions. So that's why I obtained my doctoral degree and further doing postdoctoral research fellow here at Hopkins. And music therapy involves the therapeutic application of customized and individualized music interventions by credentialed professions who use music purposefully to support non-musical outcomes in our clients. So key domains of treatment include, but not are not limited to cognition, like addressing memory, attention, and problem-solving skills, and motor development. For example, like a supporting the coordination and physical rehabilitation, and also the social emotional development, enhancing the emotional processing, empathy, and social skills. Also, the communication, sensory regulation, and self-expression, and so on. So I could be biased, but then the beauty of music therapy is that because it's flexible, right? We can be flexible during the in terms of the therapeutic relationship and also progress of the sessions, and also it can promote self-expression and could be a great motivator. So in terms of the self-expression, music can offer both verbal and non-verbal pathway for communication, giving clients the accessible way and means to express emotion, thoughts, and their experiences. And also, in terms of the flexibility, as I briefly mentioned, the music is a creative and more like a makeable and diverse therapeutic medium. And lastly, motivation. So music is relatable and enjoyable, the human experiences, and basically that we can get motivated when listening to music or when we are engaging certain kind of music therapy. I mean, music experiences and activities. So here, in terms of the brain in general, music activates just about almost a lot of brain regions, including basic auditory pathway, because we are listening to music, right? And then the attention and work memory network, also the motor network, and reward and emotional network that are associated with our movement, speech, cognition, and emotion. So you don't have to memorize all of this, and I'm not gonna give you any quiz or so. But the reason that I'm showing you this figure is that to demonstrate a lot of variety of regions, brain regions, are activated when we're listening to music or when we engage some music activities. And also we use the certain like a neuroscience mechanism like brain plasticity, which refers to the ability of the brain to modify its connections or rewire itself. So for example, the music could be the medium and vehicle or avenue to modify its connection and rewire the network. So, given those profound correlations between music and brain function, the National Institute of Health (NIH) initiated the Music and Brain Health Initiative in 2019, which is great for our field, allocating the increased funding towards the advance of research and development in the music-based intervention for clinical populations. So I would like to go over like three big domains today, including cognitive psychosocial support and speech support, as well as the movement support. So our first domain is the cognitive and psychosocial support. So I would like to give you the basic and principle and brief background of how music can address each domains, and then we can go over a quick kind of like a demonstration and do something fun activities for each this domain. So for the cognitive and psychosocial support, so one example that comes to mind is from my own childhood. So my mom taught me our phone number. Back in the day, we didn't have cell phones, so we had to memorize all the phone number, right? So my mom actually used melodic tone that I can memorize that phone number, our phone number, very quickly. So I still remember that because that was like very simple melodic tone, like 402 8091 402 8091, something like that. So by using some like a very familiar tune, my mom used some great strategies to memorize this phone number. And also, I remember that my music teachers used the melody again to help us memorize some the dynamic of music, showing another way to music aids cognitive function. So, for example, like the dynamic from the largo, andante, andantino moderato, and so on. So I still remember that one. So rather than memorizing those terms just as a term, if you can have the familiar melodic tune and simple melodic tune, it makes us easy to memorize. And also beyond this kind of like simple memory, music can also evoke and strengthen our autobiographical memory. So just imagine the song, like for example, let me quickly share some quick music here.
And now the end is near, and so I face the final curtain. My friend, I'll say it clear, I'll state my case, of which I'm certain.
Okay, I would stop here. So if you listen to this music, you may have your own specific memory, and hopefully when you listen to this music, you may recall about today's event in the future, right? So you may have your own music to evoke or take you back to the moments that of the specific moments and events, people and time and so on. So yeah, we utilize those musical power to evoke your memory that can connect to your autobiographical memory with your close loved one, your family and friends and so on. And also, in terms of the research, brain research wise, it has been shown that the listening to long known music, which is your favorite music or familiar music, can have like greater brain activation compared to the music that you recently heard. So, for example, in this figure, the top banner, you see some red and red. So red indicates a more activation. And here the top panel is that top row is that long known music. So when you listen to the familiar and familiar music, and then the middle one is the music brain activation when you listen to music you just recently heard. So as you see between the first and second row, you see that more red and broad activation in red for when you're listening to the familiar music. And also music can help us feel better. So again, in this figure, it's very complicated, a lot of dots and connection. I don't want you to memorize all this thing, but then again, the relationship between humans and music has been very dynamic, not only for the like cognition or motor effects, but then also your emotion. So for here, this figure illustrates the more deeper level of neurobiological mechanism involved in the social neuroscience of music production, including the like empathy circuits in our brain, as well as the reward system, which are the fundamental components of our social interaction, as well as your emotions. So music has a profound impact not just on the brain cortical network and circuit, but also more like on the chemical level within our body, which plays a crucial role in emotional regulation. So research has shown that the music can influence like a various neurochemical system, including those involving like oxytocin or cortisol over here. So yeah, that was a brief part of how we can utilize music for cognition and emotional aspects. And the next one is the music therapy for speech support. So music therapy can be also a powerful tool for supporting the speech and communication, utilizing the specific brain and behavior mechanism that engages the brain area involved in language, motor control and emotional expression. So for example, the speech is not only for just sound making, right? It involves like motor aspects over here, as well as the way that you are expressing and communication. So not only for just speech production, producing the sound, but then a lot of different components are engaged. So we can use, for example, the rhythm for your speech, because speech is also rhythmic aspects, right? That also involves rhythmic aspects. So we can utilize rhythm for your speech rhythm and fluency. So for example, by using some metronome beat, like very structured that metronome beat sound, or rhythmic music or rhythmic tune in a song can facilitate the smoother speech patterns. So for example, the beat musical beats and rhythmic beat can provide a pacing cue that helps regulate the timing of vocalization, allowing the individual to speak more fluently and more great flowness. So this approach might help the synchronize the speech pattern with the rhythm, facilitating the natural sounding speech in improving speech rhythm and reducing some disfluency in individual with, for example, stuttering, as it helps regulate speech tempo and reduce the anxiety that often came with the stuttering. And also we can utilize the melody. So use of melody in speech can help with, for example, the prosody. So the rhythm, pitch, melody, and intonation pattern that gives speech its more like a natural flow and the expressiveness. So when individuals struggle with the like a monotone or the robotic quality of speech, like da 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 da, I'm fine, and you know, rather than more melodical intonation, you can use the melodic intonation that can introduce variety of pitch and rhythm that can make the speech more dynamic and less effortful. So this not only improves fluency but also helps with the emotional expression, as the melodic contours can convey the meaning and also emotion that may be otherwise difficult to express. Also, the dynamic music, we can also use the components of the dynamic in speech. So for example, for the dynamic in music are particularly effective in addressing issues related to speech clarity and more articulation and the loudness. So yeah, I mean, with the 100 or like speech, without further ado, I'd like to do some quick demo with you. So I know it's kind of like an awkward that I can see you that you were following, but I will try to get give you the clear direction so that you can follow. So for example, and my apologies in advance that my voice is not that great. So my voice might be not good at singing today because I got a cold. But here is the thing. So for this speech articulation first, here I would like to use some visualization with your mouth shape. So here you see the a, e, o, u. So again, not only making your sound of a, e, o, u, but then you can exaggerate this shape of the each tone a, e, o, u, so that you can also exercise your motor here. But here, rather than just doing a, e, o, u, I would like to give you some rhythmic cueing as well as some melodic cueing so that you can this melodic cueing and rhythmic cueing can facilitate your movements and producing the sound. So you can try it, you can speak out loud and you can try by yourself. We can start with a, e, o, u. So just like exaggerate your motor aspects. So for example, we can do a, e, o, u. Time constraint, I can move on to the next. Here you still see the same the picture of the mouth shape, but then you see some different size of the visualization, right? So that indicates we can exercise from soft sound to the loud sound, and definitely my musical cue from the soft sound to loud sound can also kind of like lead you to follow and naturally mimic to this musical cue for in terms of your loudness. So for example, the same thing, but we can start from the very soft sound and to getting louder. So ready? 1, 2, 3, 4, and a, e, o, u. And we can repeat several times. So a, e, o, some like a reverse direction, so from loud to soft, because in our daily life we need to modulate our voices volume. Sometimes like we need to make some loud sound, and sometimes we need to make very speak very soft, right? So this would be the very important and basic exercise with music. And also same thing, you see the same photo, but you see some different layover the heights of the figure. That means that we can also exercise with some intonation. So e, o, u, something like that. So for example, when you are doing this exercise, by using some your motor cueing, your motion with the intonation would be also helpful. So we can just quickly demo for this. So 1, 2, 3, 4. E, I, O, U. E, I, O, U. So we can stop here. This was very quick demonstration, but then I wanted to show you that how the melody cueing, tempo cueing, and dynamic cueing can mimic, you can mimic those sound for your articulation as well as the dynamic and the loudness. So next, we can sing, right? We can sing, but more if we want to focus on more like performance aspects, we can utilize some this different visualization of the lyrics. So for example, this arrow indicates that you can hold your breath as long as you possible. And then for the different size of the tempo, again, for the different the loudness of the sounds, and also again the holding. And so breathing control is the basic the mechanism of our speech production, and then by using some this lyrics and singing a song, we can also be fun. At the same time, we can focus on some the functional performance aspects. Okay. So let me move on to the music therapy for physical support. So music can be used as a therapeutic medium, not only to support the emotional aspects or speech aspect, but also the functional performance, like the motor aspects. So again, by using the musical components such as rhythm, melody, and dynamics, we can facilitate your movements. So for example, you may have experienced nodding your heads or tapping your feet like subconsciously when listening to music, right? So that is because your brain associated with the motor is entrained on the subconscious level when you listen to music or rhythm. So we can use those very basic but very important mechanism to the therapeutic settings. So here, again, this figure, I would like to show some brain figure that shows some how we can utilize music in terms of the entrainment. So here is you see some like this red auditory cortex here, and here's the auditory cortex, and here is the M1 region which generate our movements. And here the yellow arrow indicates our internal generate movements that Parkinson's disease or atypical Parkinson's disease patient might usually show the less activation of this pathway due to the dopamine malfunction for PD and other the brain the region pathway. However, the music or metronome beats as an external musical cueing could bypass through other brain area and pathway to get, for example, like this white. You can bypass the music can bypass the region and pathway to get to the motor regions to produce our motor performance. Or music has been known to enhance the remained this yellow internal pathway. So as a neurologic music therapist, we use lots of rhythms to improve the gait patterns or the balance of the gait. And also, in addition to rhythm, the melodic and musical patterns are also employed to encourage patients to naturally mimic and follow the targeted movements. So I'd like to quickly show the examples of the video with you.
Hurry up. Bye. I'm almost done. Okay?
Yeah, almost here, you know. Without a pain.
Yeah, this is the example of the stroke patients, but it has been also widely known to using rhythmic auditory stimulation for the Parkinson's disease. But the research to date, atypical Parkinson's disease, we recently published, actually last year, actually 2 years ago, we published a paper for the rhythmic, how this rhythmic auditory stimulation can impact to the atypical Parkinsonian disorder patients as well. So still, we are more investigating in terms of the impact of rhythmic auditory stimulation for the APD. But then, given the common features with PD, we hope to utilize this rhythm for the atypical Parkinson's disease or for the gait aspect as well. So yeah, use the metronome. So you can download the metronome to your phone so that you can utilize this rhythmic and structured tempo for your gait and other structured movements. So I can actually share the place and link where you can download the metronome after the presentation so that you can get the idea how you can utilize it. So not only for the rhythm, I mentioned that we can also use a melodic pattern and also dynamics, right? Because our movement can be mimicked or can mimic the musical pattern. For example, when you're listening to like ascending scale, our movement tends to more go up rather than down, right? So having you to naturally follow the melodic pattern. And also, for example, when you are exercising the lifting your knee like a marching seated position, rather than just doing the exercise up, down, or up and down, we can use music, right? So that you can have some more motivation and the musical cue can facilitate you mimicking the pattern naturally. So for example, you can also demonstrate and follow. We can do raise our knee up, down, up and down. So like a up and down and up and down and up and down and up and down. So for here, like you may have realized that whenever I ask you to up with the verbal cueing, I also played some ascending scale and more dynamics so that you can naturally follow and mimic the rhythmic and melodic pattern. So given our time, I may not do all the movements, but then as a demonstration, but then I wanted to highlight that we can utilize multiple ways of rhythm, melody, and for a lot of our movements. So for example, not only for the lower limb side, not only gait or the lower lower limb, but then we can also use it for the upper extremity and small movements as well. So for example, if we want to some like a shoulder round, the musical pattern more like a round pattern, like round and round and round and round and round and round and round Yeah, so sorry again that we cannot go over all the pattern, but then I would like to highlight that different melody pattern would lead your different pattern of movement. So again, for the small
30
movement as well.
seconds.
So yeah, here is the takeaway and suggestions. So first, leverage your familiar music for the memory activation. So play songs from your loved ones, past, especially from their younger years, as familiar music can often stimulate autobiographical memory, as I mentioned, and evoke emotion and encourage the interaction. And also rhythm. So use rhythm and support. I will share the metronome app link so that you can download it for the physical activities. So like a gait, walking to a beat can support the your balance as well as the motor coordinations. And also you can incorporate simple instruments for engagement. So instruments like shakers, drums, or bells, or you can utilize the fork and pen, like kind of like creative way to encourage your active participation. So this hands-on interaction can be both mentally and physically stimulating and provides the outlet for your self-expression. And also create some musical list, a playlist for not for the patient but also the caregiver's break as well. And they utilize music as a prompt for daily routines, and you can also experiment with singing for not only for singing for fun but in addition for more like your breathing control as well as the different loudness and articulation. And also I would like to have like attend any support group that you can find, and not limited to music therapy support group, but then it's gonna be great if you can find some support group, music therapy support group. But then we do CurePSP provides the music therapy support group, so I encourage you to attend that the sessions. And yeah, I would happy to also send the information. So yeah, thank you so much. It was very hard to compact and condense all the information to this 30-minute conference. I mean the presentation. But please feel free to email me and email us. I can also share my email address. And thank you so much.